Duns, beautiful people. Hello, everybody. Hello, my Duns, beautiful people. How you guys doing? How's everybody? I hope we're all keeping healthy, keeping safe, and loving on each other. In this video, I will talk about if your loved ones or you have been diagnosed with renal failure, how do you know whether hospice might be an option for you? Okay, so please stay tuned for the whole video. I'm going to ask you to like and share. Okay, share it with anyone you think this video might benefit, that this video might teach them something, that they might learn something from this video to take to their doctors, to kind of open up a conversation. Okay, once again, as I've said in previous videos, I do not want my hospice videos to be sad videos. Okay, this is not a sad environment. Duns, beautiful people, we are great spirit, we are great energy. Okay, we love life, we celebrate life, we live days every day, we take every day, day by day. All right, so when I'm making these videos, you know, it's not supposed to be sad and depressed. It's supposed to be a tool, an empowering tool. Okay, that's how I see hospice. Hospice is another empowering tools that we have in our belt. Okay, another tool we have in our belt to use, to utilize, so that we can have control over our life at the end of life, where we're all slowly walking, driving, or flying to. Okay, so that being said, my Duns, beautiful people, let's get straight to the video. I'm going to talk about some of the factors that might might kind of let you know that it's time to call your local hospice office. Okay, all right. First, we are going to talk about some of the symptoms, okay? Some of the signs and symptoms that your loved one, okay, somebody might exhibit who has a renal disease, okay, who's on renal failure, okay? Some of the signs are you are urinating, okay? You're urinating, peeing less, okay? So you're not going to the bathroom as much. And get this, some could also be more, okay? So either you are peeing a lot less than you usually pee before, or more, okay? So that's one of the signs. Another one is itchy, okay? Itching. You will see that the person might say, you know, my skin is itchy a lot. I feel like something is crawling under my skin, okay? They might constantly be itching, okay? That's another sign. Another sign would be swelling of the hand and feet, okay? Swelling of the hands and feet, okay? Their hands and their feet will look bigger than normal. So I'm gonna keep it very simple. You know, I'm not gonna go into big terms. I'm gonna keep it straightforward, simple, because I know a lot of people who's watching, you're not too familiar with medical terms, and I want to speak in a way that everybody can comprehend, okay? So besides the swelling of the feet and hands, another big symptom might be backache, okay? The patient might say, oh, I have backache, okay? In the medical field, we call it flank pain, okay? It might be on the left side, it might be on the right side, okay? So your loved one will say that, oh, my back is hurting me, all right? Another one might be also trouble breathing, okay? They might have trouble breathing. difficulty breathing, okay? It's hard to catch their breath, okay? And another sign that I've seen might also be a lack of appetite, okay? Lack of appetite. So these are the most common signs, okay, that I've seen. There might be more signs and symptoms out there, okay, but just to review, okay, and I'm gonna also put it up. It would be look out for the urinating, okay, how much or how little the person is peeing. Look out for itchiness. Look out for swelling. Look out for back pain. Look out for trouble breathing, and also lack of appetite. Okay, my Duns beautiful people, those are all the signs and symptoms. Well, I shouldn't say all, but those are most of the signs and symptoms that if you're experiencing these things, bring it up to your doctor, okay? Now, that being said, once you've brought this up to your doctor, all right, your doctor will most likely do testings, okay? They'll most likely do blood tests, okay? Urinary tests, but most likely blood tests, okay? And I just want to talk about 3 different blood tests that your doctor will perform, okay? And I just want to throw these terms out there. Like I said, I know most of you might not be experts at this, but these are just things to keep in the back of your mind, to ask your doctor, okay, to ask your doctor, hey, can you check this? Can you check that? Okay. All right. One of the labs that they'll look for is your BUN, okay? Your BUN, the other one is your creatinine level, BUN creatinine, and also another one is your EGFR, okay, your EGFR. All right, and I'm going to put these in the description bar, okay, so you could kind of have them to look at. Now, I'm not going to talk about a value, okay? I'm not going to talk about a number that's to look out for. Like, I'm not gonna say, okay, this number is bad or this number is good. The reason why is because your doctor will let you know whether or not the number is good or bad according to you. And the reason is because they look at, it depends on your age, it depends on your sex, whether you're male or female, and it also depends on your race, you know, if you're black, white, things like that, okay? So these 3 factors, okay, goes into account regarding these tests that I listed, okay? It depends on your age, your race, okay, and also your gender, all right? Because for a man, one level for a man might be normal, whereas one level for, you know, a woman might not be. One level for a African American person might be normal, whereas for a white person it might not be, okay? So I don't want to put out numbers out there, okay? I just want you guys to ask your doctor, ask your physician, hey, you know, have you checked my creatinine level? Have you checked my BUN level? Okay, have you checked my EGFR level? All right. Okay, my Duns beautiful people, like I always said, the more knowledge we have, the more in control we will be, okay? So I talked about the signs and symptoms to look out for. I talked about, you know, the tests that your doctors will most likely make. Now, the final thing that I want to talk about is, you know, hospice. How do you qualify to be under hospice? Okay, once your doctors say, you know, this is the numbers, these are your signs and symptoms, where does hospice come in? My Duns beautiful people, hospice comes in, okay? Hospice is helpful if and when the patient says, I no longer want to seek dialysis. I want to stop dialysis. Okay? Think about it. When you're in dialysis, okay, when you're on dialysis, most people go at least 3 times a week. Okay? Say you go Monday, Wednesday, Friday. And say, dad has been doing this, has been on dialysis for, let's just say 5 years, for example, okay? Dad is tired. He doesn't have a good quality of life, okay? Dad cannot travel like he would like to. He cannot go very far. He's limited. And although, we can make arrangements for you to get dialysis when you go elsewhere, but some people still see that as, a challenge. All right. So dad has been on dialysis for years, and he's not a good candidate for a transplant. Okay. He's not a good candidate for kidney transplant. All right. And dad says to his loved ones, to his family, you know what, guys? I'm tired. I'm tired. I'm done. I've had it. I don't want to do this anymore. And so this is where hospice would come in, okay? Somebody would qualify under hospice if they choose to stop dialysis. Because we know that once the person has decided to stop dialysis, usually within a few weeks, okay? Doctors usually give you a few weeks before you pass. So if you decide to make that decision, okay, it's completely your decision, your right, all right? Then hospice would come in to manage your symptoms, okay, to manage your symptoms at end of life. As I mentioned regarding the itchiness, we have lotions that we can give you to help with that, okay? Regarding the pain, we also have medications we can give you to help you with the pain, all right? With breathing, okay, if you're having difficulty breathing, we have medication, we have oxygen, we have breathing therapy that we can provide, okay? So we're there for support, okay? If you're having skin problems, we can, do wound care. We're there to support your family. Social worker will be there to talk to your family. Bereavement services, okay? Your hospice nurse, the whole team will be there to guide you, to walk you through it, so that you and your family don't have to feel like you're all alone. Okay, you will have your loved one, okay? You or your loved one. Like when I say you, I'm talking about like the caregivers, okay, or the person themselves. All right, will have access to a nurse 24 hours, 7 days a week. So if something were to happen at 2 a.m. in the morning, okay, you could call and say, hi, this is so-and-so. I'd like to, talk to a nurse about this topic, that problem, this problem that my loved one is having, or I'd like a nurse to come and make a physical visit, okay? That's something that's available to you, okay, being on hospice. So these decisions, okay, this decision will definitely not be an easy decision, because from my experience, okay, I actually had a lady a relatively young woman, actually. She was in her 50s, okay? She was in her 50s, and she has, she had 2 children in a loving husband, okay? So she's in her 50s, she had 2 children and a loving husband, and she just decided she didn't want to do dialysis anymore. And her family took it really hard. Her family actually did not agree with that decision, but at the end of the day, it's your life. She's the one who has to, only her can make that decision. And, she was alert and oriented, able to make her own decisions. And, the family says, they felt like she was just giving up on life. And then she told them, what kind of a quality of life is that for me? That's not how I want to live. And she had been going through dialysis, I think, for at least 2 years by that point. Okay. So in the beginning, her family strongly had disagreed, but towards the end, the family thanked us. You know, the family was like, thank you guys. Thank you, thank you, Hospice, for having been in our home, for having guided us through it all. So even though it wasn't easy for the family, having Hospice there, it was a little bit bearable. Okay, more bearable to say the least. All right. So, my Duns beautiful people, this is what I had to share with you today. Please like, comment, subscribe. Yes, 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 yes. Very important. Subscribe to my channel if you have not done so. Okay. I plan on talking more and more about hospice. Okay. And also, as you all know, here at Duns Beautiful People, we talk about what? Hospice, relationships, and natural hair. Okay, so I have something for everybody. But I want us all to know that life is what you make out of it. Okay, and end of life is life. I love you with the love of Jesus Christ. Duns beautiful people. See you in the next video.